Hello friends, welcome to today's episode whereby we will be discussing about genital tuberculosis. Genital tuberculosis is very important from Indian context because very common in Indian women and at the same time very common for MCQs. So I'll be telling you about all the MCQs that have come and might come in the next years from genital tuberculosis. Now genital tuberculosis can be primary, can be secondary. Primary genital tuberculosis means first time genitals में ही tuberculosis हो रहा है. This is very rare. Secondary genital tuberculosis is most common. तो first primary site कहाँ से आ रहा है? Primary site in descending order will be lungs. सबसे most common site is lungs, followed by your lymph node tuberculosis and thirdly is your abdominal tuberculosis. Abdomen के other organs से आ रहा है. So this is the secondary genital tuberculosis is more common. The primary being in descending order the lungs, lymph nodes and abdomen. So what is the route of spread? Route of spread is mostly hematogenous. Route of spread is mostly hematogenous. Remember this. And so कहाँ से आता है? Most common hematogenous spread mostly from the lungs, lymph nodes and abdomen. Okay, and most commonly PID in virgin girls means unmarried girls. Okay, will be the most common cause. Virgin girls का most common cause will be PID. It will spread from the PID to the genital tuberculosis, that is the tubes. Okay, most common site of genital tuberculosis is the fallopian tube. Remember, it is the fallopian tube is the most common site. Second most common site is the endometrium of the uterus. Endometrium of the uterus. Now bilateral fallopian tube involvement occurs. Bilateral होता है क्योंकि वो secondary होता है and through hematogenous spread it comes. Now in the fallopian tube also it can be three types of infection. It can be endosalpingitis, okay, then exosalpingitis and interstitial salpingitis. Okay, interstitial salpingitis. It means if we consider the fallopian tube, suppose this is the uterus. Okay, we consider this as the uterus and this is the fallopian tube. So if you see the fallopian tube, what are the parts of the fallopian tube? I had told you how to remember. IAS you all know. IAS का exam होता है तो IAS and repeat I. तो I is for number 1 infundibulum. Then comes your ampulla of the tube. Then comes your isthmus. Okay, isthmus उसका S करते हैं and intramural part. Okay, so most common site of tuberculosis is the ampulla where the fertilization occurs. वहाँ पे most common site of tuberculosis is also the ampulla. And most common endosalpingitis is when the infection starts from the inner part of the tube. Exosalpingitis is when the infection affects the outer part of the tube first, and interstitial salpingitis is when it affects the middle part of the tube, means in between the tubal layers it affects. So most common is the endosalpingitis. So endosalpingitis is more common, ampulla is mostly involved and fallopian tubes are the most common sites of infection. 90% of genital tuberculosis occurs in the fallopian tubes followed by endometrium. Okay, what is the most common age at which genital tuberculosis occurs? It is 20 to 30 years. लेकिन कभी कभी options में देते हैं 20 to 25, 25 to 30. Okay, then in that case most specifically go for 25 to 30 years of age group because it is at that time that most of the females are sexually active, PID occurs and so secondary genital tuberculosis occurs. Most common symptom of genital tuberculosis is infertility. Primary or secondary infertility occurs in genital tuberculosis. Now one very important question, बहुत interesting question आता है कि among the infertile couples, among the infertile women, how much percentage of them have tuberculosis? So remember, अगर infertility वाले patients को evaluate किया जाएगा तो 17% of the patients will have tuberculosis. ऑन द अदर हैंड अगर ट्यूबरकुलोसिस वाले वीमेन को इवेलुएट किया जाएगा तो 70% ऑफ देम विल हैव infertility. 70% will have infertility. Okay, so among the TB women, 70%, a very large percentage of patients will have infertility, but among the infertile women 17% का cause tuberculosis होता है. So this is very important. 17 and 70% you can remember. Okay, now women who conceive with tuberculosis, मान लो conceive हो गया था, tuberculosis था, tuberculosis में tubes get affected, so the tubal anatomy is distorted, tubal anatomy is distorted. So once they conceive, the most common conception is tubal ectopic pregnancy. ठीक है, तो ectopic pregnancy हो जाता है. Why ectopic होता है? क्योंकि the motility of the tube is disturbed, so after the zygote and the morula and blastula are formed, they are not being able to come properly up to the endometrial cavity, तो वो tubes में ही रह जाता है. Okay. Then comes the second most common site I have told is your uterus. Uterus में infection होता है. So uterus में infection होता है. So what will be the symptom? Endometrium is involved. If endometrium is involved, your symptoms will be number one. See, the most common sites of involvement of the uterus will be near the cornual end because they are just beside the fallopian tube. So most common symptom will be your sign will be cornual block. So bilateral cornual block in HSG, histosalpingography is most commonly because of tuberculosis. The second most symptom which can occur is pyometra. Pyometra means pus in the endometrial cavity. Pus भी बन सकता है in the endometrial cavity. Now one question which I want to tell at this moment is, what is the most common cause of pyometra? What is the most common cause of pyometra? Tuberculosis में तो pyometra होता है, but the most common cause of pyometra is in old women. So it is senile endometritis. Senile endometritis. In old women, there is infection of the endometrium, and that infection can lead to pyometra in old women. That is the most common cause. But what is the most common cancerous cause of pyometra is carcinoma cervix. Carcinoma cervix will obstruct, block the outlet, so there will not be any drainage of physiological fluid, so there will be pus formation, followed by carcinoma endometrium, which will also lead to pus formation. And most common benign cause of this pyometra will be senile endometritis, followed by tuberculosis, genital tuberculosis. Okay, so these are important. Next, coming to what is the third feature which can be seen, cornual block, pyometra, then comes Asherman syndrome. Asherman syndrome can also be seen. What is Asherman syndrome? Asherman syndrome is when the endometrium cavity is being blocked by fibrosis. There is fibrosis inside and this has blocked, so there is no menstruation. So Asherman syndrome patient will present with oligomenorrhea. Oligomenorrhea means less bleeding, followed by amenorrhea. Okay, so the most common symptom with which patients of genital tuberculosis of uterine involvement present is oligomenorrhea and amenorrhea. But you should remember that in the first phase, जब tuberculosis हो रहा होता है, then patient will present with menorrhagia. In the beginning there will be menorrhagia, means heavy menstrual bleeding because there is irritation of the endometrium, followed by later on changing to oligomenorrhea and then amenorrhea. So पहले periods बढ़ जाएंगे, फिर धीरे धीरे कम हो जाएगा and then बंद हो जाएगा. Okay. One more important thing I would like to tell is how do you diagnose this endometrial tuberculosis. The diagnostic modality will be your endometrial biopsy. Endometrial biopsy is done. When is endometrial biopsy done? Day 2 of cycle. Day 2 of cycle. शुरुआत वाले part में करेंगे, day 1 to day 2 of cycle. Why? This is because number 1, the os is open at that time. External os is open because patient is menstruating. दूसरा है menstrual blood can be taken. Menstrual blood can be taken for TB PCR. TB PCR. PCR polymerase chain reaction. This is very diagnostic test जिसमें AFB bacilli can be found. Okay. If it is an unmarried girl, then do not take endometrial biopsy. For unmarried girl, you just give them a container and ask them to collect the menstrual blood. They will bring the menstrual blood, 1 to 2 ml of blood is okay, and you directly go for TB PCR. Okay. Apart from that, HSG हिस्टोसैल्पिंगोग्राफी इज कॉन्ट्राइंडिकेटेड इन जेनाइटल ट्यूबरकुलोसिस. अगर किसी का ट्यूबरकुलोसिस एस्टैब्लिश्ड है तो HSG नहीं करना है बिकॉज इट विल लीड टू डिसेमिनेशन ऑफ द डिजीज इनटू द पेरिटोनियल कैविटी. बट इफ इट इज एन HSG इज डन फॉर अदर रीजन, मे बी फॉर इनफर्टिलिटी, and opportunistically you can diagnose that patient is having genital tuberculosis. How do you know this? This is because the tube's anatomy will be distorted. Number one, tubes will become beaded in appearance. Beaded सा appearance हो जाएगा. This is called salpingitis. Remember this term, very very important. Salpingitis isthmica nodosa. Okay, nodosa. Salpingitis isthmica nodosa is specific for tuberculosis, beaded appearance of the tubes. Apart from that, there can be other appearance like lead pipe appearance. Lead pipe when the tubes become very tight and retort shaped. Okay, so lead pipe appearance. Then you have retort shape appearance. Okay, retort shape appearance can be there. Then you can have the golf club tobacco pouch appearance. Okay, tobacco pouch appearance can be there. Tobacco pouch appearance occurs when the tubes ka lateral part becomes dilated like this. It becomes dilated. So this is how you can find in HSG also. Apart from that, what you will do, what is your treatment is ATT. ATT for 6 months you will give. 6 months ATT will be enough, whereby you give HRZD and HRE regimen which is given. Okay, so this is all about your genital tuberculosis. If the tubes are very much distorted, then you can go for salpingectomy or clipping of the tubes followed by IVF. So this will be the treatment.